Hello, my name is Victor Miranda, and I am a microbiology major here at the University of Arizona. I've been working in Dr. Mike Khanna's lab for the last year, and the main focus of the lab is to study ALS, specifically a protein called TDP-43 that has been found to have mutations that lead to ALS-like symptoms. Studying ALS is very important for two major reasons. One of them being is that there are only two FDA-approved drugs that only treat and slow down the symptoms and don't make a permanent solution. The other being is that ALS is a very dangerous and fatal disease. So after diagnosis, the average lifespan of an ALS patient is 2 to 5 years. These years give a very low quality of life in which first their ability to speak, walk, and eat slowly decreases because of motor neuron degeneration, eventually leading to the loss of being able to breathe and ultimately death. There are two types of ALS, familial and sporadic. The one that we study is familial.
This figure is showing the structure of TDP-43. On the left we have the N-terminal domain displayed in orange. In blue and green we have the two RRM domains that bind to RNA. And on the right we have a gray C-terminal domain. Although most of the mutations that lead to ALS symptoms in patients are found in the C-terminal domain, there is a debate about whether the N-terminal domain can either be neuroprotective or neurodegenerative. Some research has shown that the N-terminal domain interacting with itself can be neuroprotective, while other research has shown that the interactions between other N-terminal domains of TDP-43 or interactions with itself has led to ALS-like symptoms. For that reason, we've developed compounds that might inhibit this N-terminal domain interacting with itself, and we are using these to either test whether this will develop ALS symptoms or not. So what we do is test whether these compounds can bind to TDP-43 using STD-NMR, HSQC-NMR, and other biochemical tests. Our studies have only been so far testing whether these compounds are able to bind to TDP-43. Further work in our studies will continue with cell lines, seeing if these compounds are neuroprotective or neurodegenerative, and being able to take a stance on this debate. Some of the cell line work will be done with collaborators. However, some final questions that I have done at the end of the summer are: what methods can you take to optimize leading drugs to increase the pharmacophore or the effectiveness of the drug? What chemical methods can you take to optimize these drugs? And what steps does the FDA take to ensure that these are approved for the public to use? I'd like to give special thanks to Dr. Mike Khanna for letting me work in her lab, Dr. Vijay Gokhale, Dr. Liberty Mutal, David, Jonathan, Nilafar, and Rizaz. And also special thanks to Emily. She helped me out a lot this summer.